Hello everyone, this is Dr. Alsop and we will be discussing the location of two of the three main salivary glands. I hope that these are on the easier side to locate soon for you, and then they can help guide you in identifying some of the surrounding structures, which they often do for me. So let's get started. Alright, we are looking at the largest salivary gland here, and this is the parotid gland. And I'm going to kind of outline the general location of the parotid gland. It is this prominent structure in the inferolateral aspect of the face, and you can really see some of those facial nerve branches extending out from the anterior or superior or even the inferior borders of the parotid gland. The parotid gland is located in the parotid fossa, which is an irregularly shaped space. The anterior boundary of the space is the ramus of the mandible, as well as the masseter, which you can see here. The posterior boundary will be the mastoid process, which is in this general region, as well as the sternocleidomastoid, which you can see a bit more clearly. The superior boundary is typically the temporomandibular joint and the external acoustic meatus, which are both deep right about here-ish. And I actually think this particular parotid gland extends a bit more superiorly, which isn't uncommon for there to be variation. And the inferior boundary of the parotid fossa is the angular tract, which is definitely not visible on this image, but it is a band of connective tissue that extends from the angle of the mandible to the hyoid. So that'll be that inferior boundary. So the parotid gland generally lies within those boundaries with some variability, which I actually think we have on this particular donor here. Now, one thing you can see quite nicely is the parotid duct, which is commonly referred to as Stenson's duct. I'm going to outline the general area, and you can see a facial nerve branch really closely traveling with it, which isn't always the case. But it is this large structure right here. It typically arises at the anterior border of the parotid gland, and I think it's a comparatively large structure, particularly in comparison to a lot of those facial nerve branches. And I say it looks similar to an artery. Not exactly, but it's a general kind of caliber of an artery. It is typically a pretty similar color to the gland. It will travel superficial to the masseter muscle, which you can see it doing here, and will dive deep to and through the buccinator muscle. And that will be right around this region here. It's basically where you kind of lose that parotid duct. You don't see it anymore. What you have right in this region is called the buccal fat pad, and it's exactly what it sounds like. It's a pad of fat that's going to be superficial to the buccinator muscle. And so if you were to remove the fat pad, you would be looking at the buccinator muscle, which is on a deeper plane than a lot of the other muscles of facial expression. And so that parotid duct will travel through the buccinator on its way towards the oral cavity. Now, the parotid duct will conduct saliva all the way from the parotid gland, which is that furthest away salivary gland from the oral cavity, to the papilla of the parotid or Stenson's duct, which you can see right about here-ish. It is this opening in the oral mucosa opposite the maxillary second molar. So that's generally where that papilla of the parotid duct can be located, and you can even try to locate the structure on yourself. Lastly, let's identify the submandibular gland. Specifically, we're only identifying the superficial portions of the gland, which you can see here and here on this particular anterior image, and you can see it over here as well. This exocrine gland is located near the angle of the mandible, which you can see nicely right here, and in that submandibular triangle. We will see the deeper portions of this gland and its duct in the oral cavity session. So those are the main glands we are identifying for this session, and once you have these locations down, I hope they can help guide you in identifying neighboring structures. Please always feel free to reach out with any questions, and have a wonderful day.